Still people coming in. This is good. Okay, I think we'll get started. Welcome and thank you for joining us this evening. My name is David Chard. I'm the Dean of the Wheelock College of Education and Human Development at Boston University. This is a third in a series of presentations that were created in response to the global pandemic. The goal of these presentations was to assemble national experts on education to address issues that arose as a result of COVID-19. We started these sessions last spring when all of us were very hopeful that as a result of vaccines and the way the vaccines seemed to be behaving, that we were going to return to some sense of normal. Hopefully, if not by late spring, by early fall of 21. The first session focused on the impact on learning of being out of school and the impact of remote learning. And in August, we held a second webinar focused on promising practices to help children, families, and schools return to school and to ameliorate some of the challenges that occurred as a result of the 2020-2021 school year. Here we are, February of the third school year that has been impacted by COVID-19. And tonight we focus on a topic that we knew would be part of the series. We just weren't sure exactly when it would end up in the series, but focus on mental health and student mental health in particular. But of course, I think we all know that everyone's mental health has been impacted, and certainly we're seeing the mental health of teachers and school leaders being impacted as well. The response to these sessions has been very positive, and we expect with tonight's panel, we will see the same. If you didn't have a chance to join us for the previous two sessions, you can find them on YouTube by Googling Wheelock and Reversing Course, and you will find the other two sessions that were recorded. This one as well will be recorded if you want to share it with others who maybe can't join us this evening. I want to thank the folks at the Ivy Street School and MAB for being terrific partners in putting these events together. And now I'm going to introduce tonight's panel moderator, Brandon Cardet Hernandez, who is the executive director of the Ivy Street School here in Brookline, who after nearly 20 years in education joined Ivy Street. Prior to coming here, he had a number of positions in education. He served as a senior education policy advisor for the mayor's office of the city of New York, and as the principal of the Urban Assembly Bronx Academy of Letters, a turnaround high school in South Bronx. And if you read in the Globe in the last couple of weeks, you would probably know that recently Brandon was named to the Boston Public School Committee by Mayor Michelle Wu. Brandon, we're thrilled to have you back for this session and look forward to the panel discussion.
And I took myself off mute. Thank you so much, Dr. Chard. It's a pleasure to be here. It's exciting to have this conversation with our panelists, and a real honor to share this conversation with our audience tonight. In December, Dr. Murthy, the nation's top physician, the US Surgeon General, called the challenges that American youth are facing today unprecedented and uniquely hard to navigate. In a 53-page report, and what many have noted as a rare public appearance, we heard what a lot of parents and educators and researchers have been signaling and fearing for a while. But in this report, the Surgeon General cited significant increases in self-reports of depression and anxiety, along with more emergency room visits for mental health issues, and the shocking news that suicide attempts rose 51% for adolescent girls in early 2021, as compared to the same period in 2019. Globally, symptoms of anxiety and depression doubled during the pandemic, the report noted. The unfathomable number of deaths due to COVID-19, high levels of fear, economic instability, forced physical distancing from loved ones, and understandably heightened racial tensions, they have all played key roles in worsened mental health among young people. But the youth mental health crisis was looming even before the pandemic started. Emergency room visits related to depression, anxiety, and similar conditions were already up 28% between 2011 and 2015. From 2009 to 2019, the proportion of high school students who reported persistent feelings of sadness or hopelessness increased by 40%. And those who seriously contemplated suicide increased by 36%. The pandemic, experts have said, has worsened all of this. The loss of routine and structure has contributed to feelings of despair, uncertainty, and disconnection. It's added to feelings of isolation and loneliness that existed before the pandemic. And according to the report, young people who may be the most prone to mental health challenges during the pandemic include young people with disabilities, racial and ethnic minorities, LGBTQ plus youth, young people living in immigrant households. A lot of those young people have been impacted even harder. And there's a lot here. And based on these numbers and the lived experience of educators, parents, and young people who are sharing their stories, I don't think anyone is catastrophizing or overstating when we say there's a mental health crisis. But if COVID has shown me anything, it is that we are adaptive, we are innovative, we can drive solutions in a time of crisis. And so I'm excited to introduce our panelists. But before that, I have a few pieces of housekeeping. First, I have a series of questions for our leaders. And like in our previous conversations, if you were able to join us, we're going to talk about the problem, but we're going to do our best to move into solutions and strategies that can impact our work day to day. Second, we've reached out to some of our friends and leaders in the industry who are going to pose some questions for our panelists. And that'll happen a little later in our program. And then of course, I'm going to be watching the chat feature. We're going to try to grab as many questions as we can from the audience and plug them in where they make the most sense. We're also going to be watching that chat, and where it also makes sense, we'll plug in some resources for folks who are asking. But without further ado, it is my pleasure to introduce our panelists. I'm going to start with Leslie Suggs, the president and CEO of the Home for Little Wanderers. With a background in social work and over 2 decades of experience in child welfare and behavioral health, Leslie has worked with vulnerable children and families in a variety of different roles and settings, including residential and special education, adoption and foster care, community mental health, and working with survivors of sexual abuse and trauma. Her passion, dedication, direct service expertise, and extensive knowledge of the field of child welfare place her in a unique position to lead the home, where in 2018, she was named the president and CEO, overseeing 750 employees and 20 unique programs impacting the lives of kids. Thank you so much for being with us tonight, Leslie. I'm also excited to introduce LaShawn Robinson, advisor for strategic initiatives at the New York City Department of Education. LaShawn Robinson brings over 20 years of educational leadership experience to the nation's largest school system. A former social worker, principal, superintendent, executive superintendent for the Office of Equity and Access, and deputy chancellor, LaShawn has led extensive portfolios that included social emotional learning, safety, nursing, mental health, counseling and crisis support, athletics, trauma responsive practices, adult social emotional learning, and the nation's largest community schools program. We're so excited to have you with us as well. And last but not least, our third panelist is Dr. Jennifer Greif-Green, an associate professor in special education at BU Wheelock College of Education and Human Development. Dr. Green is a child clinical psychologist. She has published over 100 articles on topics related to student mental health. Dr. Greif-Green partners with local schools and districts to conduct research and to support student social emotional well-being and reduce bullying. She co-directs the Social Adjustment and Bullying Prevention Laboratory and is the editor of the Journal of Education. So we promised you a great panel. This is so true, but we're going to dig in with some questions. And the first one's for all of our panelists. I'm going to start with you, Leslie. You'll kick us off. And I want to hear from you from your vantage point. How are you understanding? How are you seeing? How are you experiencing this problem, this crisis? And tell us how you're defining it and what it means in your world.
Sure. Well, first of all, thank you for having me here today. This is such an important topic. When I think about children and what their job is in being children, right? Their sole purpose in life is to be, going to school, making friends, and develop. How they grow and develop is in the context of relationships, connections with others. Those many hours spent in school, all of those important things. And yet here we have been in this pandemic where those normal structures and activities have just sort of, that whole foundation has just sort of broken away. But you rightfully said that we had a crisis that was brewing and growing pre-pandemic. which speaks to, and there's so much, there's so much literature out there. There's so much conversation about the pressure that children feel, the amount of the growing anxiety, depression, all the things, the pressures that kids are facing, and coupled with actually a real effort to destigmatize mental health challenges, that we've said, look, it's okay if you are feeling stressed. It's okay if you were feeling, to reach out and to get help, and to reach out to teachers, to reach out to parents, to reach out to your friends. We've become so much more aware as a community about how important attending to our mental health is as it is to physical health. And so in this time, in this moment in time, thinking about how those foundational pieces of mental health and health in general for kids is just critical for us as a community. And remembering the things that are really important for children, like structure, going to school, access to sports, basic needs, all of those sort of building blocks that help children grow and thrive are so critical. We see at the Home for Little Wonders, we are the largest provider of mental health services in the Boston Public Schools. For example, we have mental health clinicians that are embedded in schools providing mental health services to kids who need that level of care. And the need has grown immensely, and we see in every part of our work for children who are in the community that we're serving in schools, all the way to the children who we serve in our residential programs and group homes. The need has never been so great. So glad we're here tonight talking about this, and I'm looking forward to the opportunity to discuss solutions.
Thank you so much. Sean, I'm going to ask you the same question. How are you understanding the problem, and what does it mean in your world?
So thank you so much for having me this evening to discuss this very important topic about mental health that's certainly near and dear to my heart, especially as a New Yorker. And we were the epicenter of the pandemic. So I'm going to take us back to March of 2020, where I can recall the sounds of sirens continuously just in my community. Although schools closed, I was still responsible for reporting and to work to ensure that our young people could benefit from remote learning. But the constant sounds of the sirens, understanding the loss that we were facing in New York City, the constant news that played every day. And I know that I was being exposed to that. My son, who was a New York City high school student at the time, was being exposed, and all of the children of New York City. At one point, we had one school where the principal reported she had 100 students, almost 100 students who had lost a parent. We had students dealing with food insecurity, and we had to mobilize to feed children meals that they would often have in school settings. We had families dealing with housing insecurity. We had our community school partners mobilized to provide basic social services to families who were dealing with these kinds of challenges. And we've been dealing with these challenges for a prolonged period of time. And every time we begin or think that we're seeing the light at the end of the tunnel, then we're hit with a variable, something that we weren't expecting, and we have to make an adjustment. So we are navigating the unknown in real time for such a prolonged period of time, dealing with significant losses. That's part of the problem. That's what we're responding to. And we're all challenged in this moment, especially our young people. So our young people who are usually looking to us, the adults, for answers, for hope, to be a part of the healing process, we don't have those answers. And we've all been humbled, and we have to say to young people, we're figuring this out together. And again, this sustained period of time, March will make 2 years. 2 years, that's a long time to deal with this kind of trauma and these stressors, especially here in New York City, when we've lost so much, and our children have lost so much.
I was there in New York, and I was with you, and I know. Dr. Greif Green, I'm going to ask you the same question. How are you understanding the problem? How does it sort of make sense in your world?
Yeah, I think that all of the description that you gave at the beginning about the increased rates of depression and anxiety that we know are around 20 to 30% in increased rates of depression and anxiety for children and adolescents. And LaShawn, the description that you just gave of the loss that our children are experiencing and the trauma and loss of resources. And so I think maybe the piece I can add is that even before the pandemic, we were also trying to manage a insufficient and fractured mental health services system to support the needs of youth. And we know that before the pandemic, only about half to maybe 2/3 of children and adolescents who were experiencing a mental health problem had access to any form of mental health services. And that's not to say that they had access to evidence-based services or ongoing services, but any at all. And so we know that even before the pandemic, we were having a very hard time getting the students or the youth who needed it the most connected to mental health services that could potentially benefit them. We know that we have gaps in evidence-based care and in access to culturally and linguistically sustaining services and affirming services for the same youth who are most impacted by the pandemic. So we walked into the pandemic already with a system that wasn't sufficient to serve our youth. And as we're thinking about solutions today, I think that that's one piece to keep an eye on is what do these systems need to look like now, and moving forward, how can we be thinking about the systems that can best support our students and children?
Thank you, all three of you. You're painting, I think, a really clear picture for us around what's happening. And I said this at the top, right? Like, we know that there is a problem. We could spend an hour and a half talking about it. And I want to instead move us sort of forward, because I think, like so many of us, and to LaShawn's point earlier, like, we're all trying to figure out solutions, and we're trying to explain those to young people and to families and to educators who are on the front line. And so that's where I want to spend more of our time tonight. And so I want to ask you, and I'll start with you, Dr. Greif Green, and we'll go backwards this time. It's another question for everyone. And I'm going to sort of start at a place of opportunity and optimism. What is something that you're working on right now that you're proud of, that you want people to know about, that you think has real legs in supporting mental health?
Yeah, that's a great question. A lot of the work that my research team is doing is trying to highlight and better understand the good work that's being done by schools and by organizations around the Boston area. And one of the projects that we've been working on recently is to develop a tool that schools could use to understand access to mental health services for students and to document which students are accessing mental health services and where there might be gaps in mental health service use. So we've partnered with the Education Development Center and schools in the Metro West area to pilot this tool that the schools can use. It's a really brief survey that schools can use to understand which students are accessing mental health services and to help to design outreach and intervention plans for students who don't have access to mental health services.
Great. And so, like, you're thinking really specifically about like concentrated efforts on the school to be sort of tracking the way that we've thought about the sort of more specific instructional approaches. Like, this is another thing for folks to be looking at universally for kids. What about you, Leslie? What's something that you're working on right now you're really proud of that you want people to know about?
Well, if you could indulge me, I sort of have two things that are on two different tracks.
I like it.
Okay. One is this real focus on the basics. We have just engaged in a program called Mobility Mentoring, where we're looking at the impact of poverty, those social determinants of health, helping families with some of those just very basic needs that help families function better so that they're better positioned to give kids what they need. Kids, getting that good stuff from parents who are less stressed, who feel competent and able to meet their children's needs. Not only does that impact children's mental health, and there's really good research around that, there's also this piece around preventing kids from going into the child welfare system. There are too many times when you see the disproportionality that happens for kids who enter child welfare around race and poverty. You just can't ignore those statistics. So looking at those pieces, we've seen really good results, nationally, and we're bringing that work into the home. So that's one piece. The other piece, we just completed at the home a 4-year strategic plan, and our 4th priority in that plan is leveraging our thought leadership around these critical issues that impact children and children's mental health. The piece that Jennifer spoke of in that opening question around access is incredibly important, because we can talk all day long about evidence-based models and things that we know work. That's for naught if children don't have access to it. The lack of parity that exists for mental health in general, but certainly for children, access to qualified mental health clinicians that have training and skill to meet those needs. We have our secretary here in Massachusetts is often quoted as saying there is not a shortage of clinicians in Massachusetts. There is a shortage of clinicians who are not in private practice who allow to bill insurance. And so if whether you're a family that has Mass Health, you're a family that has private commercial insurance, getting access, the wait lists are 3 to 6 months long. And so that is, people need to know that, because I think until you're a parent of any demographic who has a child who's challenged, and certainly in the pandemic, that's something that's become so much more visible. I can't tell you how many folks just in my normal world will call and say, oh my gosh, Leslie, my son Johnny is having this, is having anxiety. I'm trying to get some help for him. And I had no idea. I've called this place, I've called that place. No one can see him unless I'm willing to pay $300 an hour. And even sometimes that's hard to access. Until it's touched your life, you don't really understand that you can't get. Now, if your child had an issue with diabetes or your child had an issue with asthma, you could get an appointment right away and have your child's needs met. But that's not true when it comes to mental health. It's really important that we keep that issue front and center in the conversation. And that's another piece of work that I'm proud of.
Great. Thank you for that. LaShawn.
Leslie, you are speaking the truth and telling the people about the reality in terms of what we're facing. We painted a picture about the problem so clearly, but mental health equity, mental health access is an important part of the conversation. In New York City public schools, we work to meet the challenge of access by ensuring that every school has access to an on-site mental health clinic or a clinical social worker in the school setting. This year, we added 500 additional social workers just to meet the goal, and that's not even enough. So we're really drilling down on access, putting resources at parents' fingertips, ensuring that they know how to access resources, either school-based or community-based resources. But what you're saying is so accurate and so true. As it relates to getting young people what they need when they need it, like in real time. We cannot afford to wait 3 to 6 months to get the needs of our young people met. So we've invested in clinical social workers. We've also expanded the research-based, highly effective model of community schools. And our community schools bring with them a whole host of resources, including mental health and wellness resources, social emotional learning, physical health resources from vision screening, dental screening, other kinds of supports. So these wraparound supports and service, they're so important to not only meet basic needs, but also to address mental health challenges. Other work that we've done in New York City include curricular resources. So ensuring that as principals return back to school the first time when we went remote, but also when we came back in person, that we would start with the adults first and ensuring that principals and other administrators and then later teachers were trained in trauma responsive practices. In New York City, we trained over 75,000 people in partnership with the University of Chicago's TREP program. And we really wanted to ensure that based on what we were experiencing during the pandemic, that our staff members and educators were trauma aware and trauma informed. So we did that work. We also took care of educators when they returned and hosted restorative circles for educators. We talked about mental health and wellness for educators, fully understanding that if we didn't do the job in terms of taking care of our educators and making sure that they could get their mental health and wellness needs met, that they would not be able to take care of our children. We provided curricular resources as well, as I was sharing earlier, so that teachers would be able to engage families and students in restorative practices, check-ins, and other kinds of classroom-based resources. But some really important work that we did was initially, we're engaged in social emotional learning and what I like to call on the fringes. So a program that we would, have a school-based program. And what we did in New York City was we really thoughtful and strategic about the integration of social emotional and academic learning. So in focusing on the social emotional skills for young people in classrooms every day and really talking through what that meant. So welcoming activities, relationship building in the classroom. So through Socratic seminar, an instructional strategy like the Socratic seminar or the jigsaw strategy, how do you utilize those strategies to build strong relationships in the classroom? So really bringing social emotional development into the classrooms and integrating that with the academics. That's all been important work that we've been engaged in New York City.
I'm going to pause the questions for a second and just say thank you to all three of you, because, I said it earlier, it's like, it's easy for everyone to just focus on the problem, and we have to, but it is really important for us to know about the incredible labor that is happening across our country to support young people. And to your point, LaShawn, to support our educators, and Leslie, to your point as well, to support families in this moment as well, and getting the services that they need. So just thank you, thank you, thank you. We're going to go back into questions, but I'd be remiss if I didn't just honor that work that's happening across our school systems, across our community-based organizations, while we're also, like our young people and like the parents and the communities we serve, managing our own crisis and the trauma in our own lives as well. I'm going to move this one over to you, Leslie. I have a question for you. At Ivy Street, we run therapeutic programming for neurodivergent kids with a real specific focus and expertise on young people who have experienced complex trauma. You also run therapeutic education programming in addition to your other programs. I'm curious how you're seeing the future of our work, given the increasingly complex trauma we're seeing in the lives of many young people. What does it mean for therapeutic education in relationship to typical schooling?
It's a really good question. We believe, we feel like we have great expertise, as you do, in serving a very specialized population of young people. And always the goal is for children to be in the most, appropriate learning environment where they feel like they belong, where they thrive, where those needs are met, with a team of teachers and supports that really get how kids learn and how they thrive. And bringing that specialization out into disseminating that information, we see as a real important piece. Partnering with our local education centers is a piece of that work. I think particularly during the pandemic, with the stressors that have been placed on teachers in public schools or in alternative schools inside public school settings, sometimes that has gotten a little lost because people are like, just hunkered down. Okay, how am I getting, how am I just simply educating folks? But the partnership that LaShawn just spoke to around teachers and mental health professionals understanding what it means to set up a trauma-informed classroom, for example. What does it mean to weave in, develop, attend to community in a school? I think that we sit in a place of having some really good information and knowledge where we can disseminate that information, and also knowing that we exist, that we're out there, that for kids who need that level of care, for schools to know that it exists, and that we're a resource to them. That piece of the continuum is very important.
Yeah, and part of an appropriate sort of school choice model, right, where kids are in the place that's right for them. Dr. Greif Green, I'm going to ask you a question, and it's a little bit of a shifting of gears, but so much work is being done to prepare and develop the current workforce and the incoming workforce to strengthen their knowledge of assessment and intervention related to young people's social, emotional, and mental health. And we need that work to focus on serving culturally, linguistically, racially diverse students. Are you seeing promising practice here? What are you looking at? What do you want to draw our attention to?
Yes, that's something that that we spent a lot of time thinking about over at BU, is how we're training and supporting teachers and educators and being prepared to support students' social emotional well-being in their classrooms. And I think there are a couple of different areas to think about in terms of training or tools that that educators specifically need. One is for educators to know how to identify warning signs, or to identify when a student might need more support than what the teacher is able to provide in the classroom. And we know that adults have more trouble identifying anxiety and depression, so these internalizing problems that are turned inwardly, than identifying students who are acting out in their classroom or expressing distress in a more obvious or outward way. So educators need tools to understand anxiety and trauma in the classroom and what that looks like, and to identify anxiety and trauma among their students, and to identify depression. And then the second bucket is that educators need to have tools around how to refer those students and connect them to services and connect with their families. So what do they do with that information? How can they connect to the services, LaShawn, that you were talking about? How can they connect to services like the home? Who in their school can they go to if they're concerned about a student, to learn more, to get more information? And a lot of times that first step is turning to another educator who's also teaching that student and saying, are you seeing the same thing that I am? Let me touch base with you here. Or touching base with a school counselor or social worker or school psychologist, and saying, yeah, here are some things that I'm wondering about or concerned about, and getting some feedback. And then kind of a third bucket we think about in terms of training is how to support teachers in providing the support that LaShawn was just describing in the classroom, how to create caring and supportive classroom environments where students can be successful, and where their teachers are doing things that we know all students benefit from.
I'm hearing what sort of landed with me, really resonated, was this one: there's just like a natural curiosity that educators have to move forward in this work holding, but also that this sort of curiosity has to happen in partnership with other people. And that's also how we break some of these disparities, right? That like we're looking at this together and not one person sort of remains or holds expertise within an organization. Fair?
And I like the phrase curiosity that you used. If I'm observing something in my classroom that I'm not sure about, what are some ways that I can ask questions or develop hypotheses around what might be happening and ensure that mental health is included as part of those hypotheses.
Sean, we talk a lot about universal supports, things that every kid needs, and then tiering services for kids with higher needs or greater challenges or other barriers when accessing learning. What should school systems or individual schools be thinking about as a universal support? Like, what's the new floor when it comes to mental health and supporting mental health? And how should school districts and school leaders be thinking about this? And I'm thinking about this, particularly as we're fast approaching budget season, and folks are making big decisions and spending a lot of money right now.
So I'm going to just take a step back because Jennifer, you have me smiling over here in New York City. Because as you were speaking, I was thinking about this year, New York City embraced a screener, a social emotional screener called the DESA. And it's a strengths-based assessment. And as you were speaking, I was thinking about how we need to normalize conversations and work around mental health. And our school system, we have vision screening and dental screening, and now we have social emotional learning screening through the DESA. And in New York City, we screened almost 800,000 students utilizing the DESA. This school year, it was new for teachers, but then it also helped us to understand a lot more clearly the whole concept of internalizing behaviors that we don't really connect with in the same way as educators as we do with externalizing behaviors, where you can see it is showing up and it's like, there's something that I need to do here to address what's happening in my classroom, because it's disruptive. But it's also disruptive when a young person is depressed, or when a young person is experiencing chronic absenteeism and you're not quite sure what's going on. You're doing everything that you can on your end, but there's something else happening there that we can't get quite, we can't get underneath. We don't quite understand. And you see this presenting issue, the young person's not showing up at school, but you don't know what's happening at a deeper level that can be connected to mental health and wellness. So this school year, we administered the DESA screener, which was, very different in our school system. And anytime you do something at that kind of scale in a school system of this size, it's a shock for the school system, if you will, because you have to align this kind of work with awareness. So purpose, people need to understand what we're doing and why it's important. We have to ensure that we have parent buy-in along with educator buy-in. And then we have to have the systems in place. That's why it was so important that we had the social workers and the community mental health support, and the increase in the number of community schools and the school-based mental health centers, because the last thing we wanted to do was not have the support readily available once we identify that a young person needs that kind of support. And we learned all kinds of interesting things through the screeners. But, one thing that we really work to do, and this gets to your question, Brandon, is how do we kind of push down a tier 2 support into tier 1? So tier 1 support is what should happen in every classroom every day, is good for all young people. And we know that research will, tells us that you're going to meet the needs of about 80 to 85% of our young people by having those kind of supportive interventions. So, those circle groups, reflective prompts, so journaling, other activities that all young people can engage in. And then tier 2 supports are smaller, more nurturing settings. So work that you'll do with young people in groups. How do we push those tier 2 supports down into tier 1? That happens for us through the context of social, emotional, and academic development, the integration of that work, but then also using everything that we were learning from the screeners in a more targeted way. So being able to identify social emotional skills that we can teach to directly. We learned that our young people, while they have so many strengths and so many talents, and they were doing really well in like relationships, for example, which kind of made sense here in New York City because we had invested in restorative practices pre-pandemic. So to see that come up as like a strength for our students across the city, that was like, okay, that made sense. And then to see areas where we still needed to grow and develop, like optimistic thinking, for example, and fully understanding what our young people are dealing with, what they're challenged by, and to be able to teach directly to those social emotional skills, to develop curricula and other resources, and to design experiences, kind of change the game for the way that we're doing the work. So making sure that, you know, we have the resources and supports readily available. The tier 3, those are supports where you need to work directly with a young person and their family to provide those kinds of supports, to make sure that those supports are readily available. So that when they're needed, they're there, but then also thinking about, you know, the entire ecosystem of supports and what needs to happen, of support and what needs to happen at all tiers to meet the needs of young people.
Keep thinking, and you and I have talked about screeners for a long time outside of this context.
Mm-hmm.
I'm thinking about data and the way, and it is like the conversation in the education space for so long, right? Like, what do we need to know about where a kid is in order to meet them where they're at? And how this becomes just another lever in really supporting a whole child and having the right information at the right time to be able to decide what works for a community. And it sounds like that's some of the work that's happening in New York right now, and that's exciting. Leslie, I'm gonna ask you a different question. You know, the struggle when talking about mental health services is that there is obviously a continuum of clinical and support services, including family programming. And the home it's leading the charge in thinking about unique and sophisticated family programming. What role can schools play in family programming? And have you seen successes that you want to share and see built on?
Yeah, absolutely. The children in schools, that's been an area where we have really focused our attention over the last, I would say, 5 or 6 years. Going back to when the home really started to grow its presence in school systems, not only in Boston, but all the way up the North Shore and actually in New York too, where we've got, children are in school, we have clinicians there, we're seeing kids, but parents are often sort of left out of the picture a little bit because parents aren't at school, parents are working, and schools feeling challenged to get access to families. So it's been a real area of focus for us to ensure that families are engaged and that families feel connected to not only our work with students, but with their child's social emotional development as it relates to school and education. And parents, they see what's going on with their children at home. So really, that's been an area of focus. I will say, one of the things that has been the bright sides, if I can describe it that way, of the pandemic was this pivot that we did to telehealth. And in that opportunity, I share the story, I had a whole work group teed up, ready to go, that was going to, on a 1-year plan to figure out how we were going to bring more telehealth into the home float of wanderers. And literally we were meeting 2 days before the pandemic sort of hit, and then Boston Public Schools announced that they were going remote. And what was a 1-year project, we got it going in 2 weeks. And all of a sudden we were, clinicians had laptops, we were getting Zoom licenses and team licenses, but that that telehealth piece and ensuring families had the technology allowed us to connect with families in a completely different way, because we could get into homes, we could meet with parents at the beginning of the day, the end of the day, and helping them with a variety of things, not only how to navigate the technology and education, but also it was an opportunity to share some of their child's struggles through the pandemic and what had been going on before, and for children to be more connected. So, a child would say, hey, I want you to see my bedroom, and this is my sister, and this sister I've told you about. So that's been a really piece of bright light as we've connected families to the mental health concerns that they might be seeing in their children.
I like this long-term strategy too, right? It's not the work of telehealth, but also even some of the remote learning and the ways we were even thinking about related services during that time, right? Like that wasn't a patchwork solution. If we do it well and we're strategic, that can be part of a long-term strategy, particularly for the complex work that is bringing families into the programming.
Absolutely. And I'll also add, we have a family partners that work in our organization. And family partners are parents with lived experience, whether it's advocating for their child in school, a child who's had social and emotional challenges. We've, really in our partnership with schools are, bringing those family partners in because they can be such a critical resource, particularly if a family has not had a good experience with school or not had a good experience advocating for their child in school. A family partner can connect with the family in a very different way than perhaps a clinician. It can be a true bridge.
Absolutely, absolutely. Including like our own sort of personal experience with school. Like we become parents with our own stories and our own journeys. And so if ours was one that just wasn't positive and where school wasn't serving us, like the complexities of the navigating are so big. Great. I'm going to move this one over to you, Jennifer. You're the co-director of the Social Adjustment and Bullying Prevention Laboratory. We know that there are obviously contextual factors that influence bullying and harassment in schools. That impacts kids' mental health. But how are you understanding, and is it even different, but how is bullying showing up in this COVID area? What are you learning? Is it impacting differently? And what should educators and parents be thinking about right now?
Yeah, thanks for asking that question. I have a new paper that I've recently been working on with Andrew Bacher-Hicks and Josh Goodman and Melissa Holt, who are colleagues of mine at Wheelock, where we've looked at rates of Google searches for bullying, which we found are related to student self-report rates of bullying, and found that they decreased during the pandemic. So following March of 2020, when schools closed, bullying seems to have decreased, and not just in-person bullying, but also cyberbullying at the same rates. And that's consistent with some other studies that have also found declines in bullying and cyberbullying during the pandemic. And some of that has started to resurface with the school reopening, but not at the same rates as it was prior to the pandemic. And so we have a couple of thoughts about why that might be. One of them is that the structure that has been needed in schools related to social distancing and adult monitoring around unstructured times like recess and time at lunch has led to fewer opportunities for social interactions, both positive and negative. And so we think that some of those changes may have changed the way that students are interacting with each other, which is you're alluding to may have led to less opportunities for building friendships and for positive social interactions as well, but may also have had a protective effect for students who were engaged in bullying and involved in bullying. So I think that there are some really important questions to be thinking about how social development has shifted during the last 2 years for our students and what things will look like for them moving forward, and how they're understanding their experiences during this time of building relationships with their peers and with their teachers, and how moving forward what they've learned in those lessons will shift the way that they interact with each other and with the world. And we haven't talked about social media usage, but obviously that was a huge part in the last few years of how we and many of our children were interacting with each other to in a much more intensive way than it has been typically. So I think that that's also something to be watching and seeing what did our young people learn from their interaction with each other online that they'll carry forward with them.
Fascinating, and I'm sure like a lot more to unpack, but an interesting bright spot. LaShawn, over the years, we've also had a lot of conversations about social emotional learning. Over the years, we've seen an increased interest in SEL programming. I think there's over 18 states who have SEL standards and competencies, over 26 who have some sort of guidance. We're watching schools, particularly given the influx of federal money, make big investments here. And of course, there's a lot of praise around SEL and there's a ton of critique. What are you thinking? What do you, as someone who's implemented one of the largest scalable, SEL programs in the country, what do you want districts and school leaders thinking about as they're making decisions right
now? One of the most effective strategies that we've utilized here in New York City has been the community school strategy. Because it includes a social emotional component to it, but the wraparound supports, especially in this moment, are just critically important. So we have utilized resources expanding community schools, along with scaling restorative practices. So having teachers and students and families trained in restorative practices. We have restorative justice coordinators trained, and they support this work across districts. That's been critical, and really supporting the building of community and strengthening relationships and creating spaces where young people belong. That work has just been critically important for us. We started the work pre-pandemic, and we've been able to continue to scale the work, including ensuring more community schools, and we're increasing the number of community schools as I speak to you all this evening. So these components are critically important, and sometimes it's not just one thing. As I shared earlier, we increased the number of social workers, we invested in curricula, we scaled practices that work like restorative practices, we're increasing the number of community schools. So it's really being responsive to the needs of the community and listening not to LaShawn this evening and the other panelists here, although I know we all have important things to say, but leaning in and listening carefully to your communities. Let's hear directly from our students. Let's hear directly from our families and understand their needs and be responsive to those needs in real time, because you will have some communities where a community school strategy is the best strategy. Some communities where you may need to think about a social worker, and sometimes it's something that we did not even consider. So how do we lean in and listen to those that we are serving, because they know what they need in this moment, especially.
And breaking to what Leslie was talking about earlier too, like breaking these cycles, sometimes generational cycles of families feeling like school doesn't serve them, when it's really the opposite of what's supposed to be happening, right? Like these are our community spaces. And if we're not listening, if we're not asking the questions, if we're not setting up the structures to really engage, then we're just doing school at people and not with people. And that, that's a broken system. I'm gonna move us. I have so many more questions. There's some great questions coming in from our audience as well that I'm gonna get to. But we have some questions that are pre-recorded from some of our friends who we called on, who we knew would generate some good thinking tonight. So the first one is for you, Jennifer, and it's from Lorena Lopera, who is the Executive Director of Latinos for Education. She's also a public school parent. And so let's hear the question that she's gonna ask us tonight.
Hello, my name is Lorena Lopera, and I serve as the Executive Director at Latinos for Education in New England. I'm also a parent to two little ones, one who's in the Boston Public Schools and one. Towards the beginning of the pandemic, Latinos for Education polled Latino Spanish-speaking families about how COVID-19 was impacting their families. And almost half of the respondents shared the concern over mental health for their little ones. Culturally, this was unheard of, and it was incredibly shocking to see. So one of the things that I think about is, as a society, how can we be better supporting our youth and families? This poll that we took was it's 2 years old at this point. So we know that there has been more trauma that our communities, especially the Latino community, has experienced. And so understanding that there is a role for schools, but that can't be the only solution for serving our youth and our families. What are the structures that we need to be creating to ensure that we're addressing the trauma, both the collective trauma and also the individual trauma that many of our comunidades continue to experience?
Yeah, thank you for showing that video clip. And that's such an important question when we're thinking about access to services. And I wanted to highlight one thing that Lorena said, which was that there was more acknowledgement of mental health and the importance of that and how that was unheard of. And I think that that's a really important place to start this. And I think Leslie mentioned this earlier also, that there's such an important need to talk about mental health and to recognize that experiencing anxiety and depression right now, having concerns about children's mental health is normal right now, and is the experience that so many parents and families are having right now. And so to have that be part of the conversation and to be having open dialogue about mental health and about these concerns that so many of us have is really important for reducing stigma, and having open communication with children and adolescents means being willing to talk about mental health. And just to highlight what LaShawn was just saying about elevating the voices of youth, of youth and their experiences is really important, especially for minoritized families and children who aren't always part of the conversation, aren't always at the table in terms of having their voices heard. And so hearing directly from children, hearing directly from families is critical. And then the question that she's asking specifically is, how do we build systems of support, and how do we think beyond what schools can do? And there's a comment in the chat also about teachers are tired. Teachers can't be everything and do everything. Schools can't be everything and do everything. And we really need to be thinking more holistically about interconnected systems of support for children and families, and how we're going to build connections across multiple systems. And I think the Home is a really great exemplar of an organization that does this and partners very closely with schools to provide services that schools aren't always able to provide themselves, and build connections to access to a continuum of care for youth. And so building those systems that are interconnected across multiple levels of support and care, and then also figuring out multiple points of entry into those systems. So not just having one point of entry into those systems, but how do we have multiple points of entry into systems so that families can come in through different ways and can try to figure out how to navigate what can be very complex systems with support.
Thank you so much for that. And I've heard in so many different ways, and I'm thinking about something LaShawn was saying earlier as well, just like embedding folks within schools who sort of own that connective tissue, right? Like really being a bridge for families to resources that exist outside of the traditional school setting. LaShawn, the next question's for you, and it's from Erin Sivak, and she's a nurse educator at BU Shield. And I'm gonna let her ask the question.
My name is Erin Sivak. I am a nurse educator with BU Shield. We're a workforce training center for school nurses in Massachusetts. One question I have for the panel, this year we've done a lot of training for school nurses around mental health, but really focused on giving them strategies and tools to respond to students who have experienced an enormous amount of trauma. School nurses don't always feel super prepared to handle that, but being that we're in a place where it's not just kids who are dysregulated, there are buildings full of adult staff members who are also experiencing trauma. I'd be curious as to what kind of mental health support systems you have within your schools and districts, how the school nurses are factored into those systems, and what kind of education and support is being given to school health professionals like school nurses.
Thank you so much for that question, Erin. And if you're out there, thank you so much for your service to our children and our school communities. And thank you to healthcare professionals who may be listening. The role of the school nurse, I would say, has changed drastically during this pandemic. The school nurse, I was a high school principal. And in my capacity as a high school principal, I was the go-to person for all things. I was expected to know all kinds of things, including, what the weather would be like, the next day. And people really depended on me for like that kind of information, which was really interesting. And I would say the school nurse during the pandemic is right up there with the principal in terms of what they're expected to know. All kinds of details about all kinds of things, major and minor. And, we have really come to depend upon school nurses in ways that, we haven't in the past. So first and foremost, thank you to our nurses for your leadership. I know that you, not only in New York City, but across the nation, you've stepped up in so many tremendous ways. You've been our go-to people, our contact tracers, our folks with resources from now test kits to, making calls home. So thank you. From the lens of mental health and wellness, we have included our nurses in training that we've offered. So the trauma responsive training and other training that we've done here in New York City. But the takeaway that I want the audience to have tonight is the concept of teaming in a school, because that's such an important concept. And, we have to think about pupil personnel teams in a very different way, where pupil personnel teams or student support teams, whatever you may call it in your school, can include the nurse. The social worker is a part of that team, the guidance counselor, the principal, teachers. Like, we have to think about how we support each other in different ways than we've done in the past. It's going to take the sum of the collective, all of us, to continue to navigate through this pandemic and to ensure that we're taking care of ourselves and each other. It will ensure that we're not overwhelmed, right? Because no one can take this on their own. It cannot be just the school nurse or just the social worker or just the teacher that's expected to respond in this moment. So yes to the training for nurses to think about their role in mental health and wellness, which is, slightly different than in the past. Yes to the trauma responsive resources and care for nurses, but certainly yes to us thinking more strategically about teaming and how do we include personnel as part of teams to be able to address the challenges that we're seeing, to make sure no one, feels like they're alone and overwhelmed, which I know, people who own the role in the school. I'm the only nurse in the school, right? So no one understands what I'm going through. I'm the only social worker in the school, so no one understands what I'm going through. To really bring people together in powerful ways as part of the strategy as we continue to navigate through this pandemic.
Thank you for that, LaShawn, and it brings me back to something that Dr. Greif-Green was saying earlier too, right? Like this collective curiosity that we are structuring in a teaming approach, right? People coming together instead of leaving the sort of decision-making in a sort of in creating decision-making in isolation. Thank you for sharing that. And the next question is for you, Leslie, and it's from Nate Weaver. He's a teacher. He's the evaluation team lead at Chelsea High School. And he's a great question for you, so I'll let him ask.
My name is Nate Weaver. I'm the evaluation team lead. In Chelsea, there are a lot of community groups and organizations that support students' social emotional needs outside of school. My question for the panelists is, how can schools and school personnel further connections with community organizations and social services that are supporting students' mental health?
That is such a great question. I think there was the question in the chat, which was rightfully asked, is that there is so much that we ask of teachers and of schools, and the burden of knowing who the community partners are, how to, screen kids for a host of issues can be overwhelming. I think a part of the responsibility of community partners is also to let schools know about us. That a part of our work is to outreach to schools to say, we are here, this is the work we do, we want to partner with you, reaching out to the principal, reaching out to the community liaison, and engaging people in system of cares. There are system of care structures that exist, I know certainly in Massachusetts and in Boston and in New York, that bring a host of people to the table that are there to serve children, educators and clinicians and psychologists and coaches and housing folks and folks from probation, all of the, and letting you know we are here and we want to partner with you. LaShawn said it so well. The team approach to meeting the needs of children, we cannot do any of this work in isolation. The burden should never be placed solely on a teacher or on a nurse or the mental health professional. We all need each other. So I think that it is our responsibility to ensure that in Chelsea Public Schools what the resources are, and that we are here to support you.
Thank you for that. Dr. Greg Green, you're up next. And this is one, like any of the questions, obviously, we can jump around at any time, but I want to ask you this, and this one comes from Ashley Constantine, who's the Chief Program Officer here at the Ivy Street School. So I'm going to let her ask.
My name is Ashley Constantine, and I'm the Chief Program Officer at the Ivy Street School. We all know the COVID-19 pandemic has impacted the social, psychological, and emotional well-being in our communities to the point that it's being considered a global collective. For many young people, the impact of COVID-19 has doubled down on pre-existing trauma that they have personally experienced. My question for the panel is, what tools, training, and coaching should we be systematically providing to teachers and school personnel to address the impact of trauma affecting young people in our schools?
Yeah, I wanted to start by highlighting something that LaShawn mentioned earlier, which is that we need to start by caring about the adults and making sure that we're providing support to adults. And in order for adults in the school and family members too to be in a position of supporting students and youth who've experienced trauma, we need to make sure that the adults, many of whom have experienced trauma in the last 2 years themselves, have support and have people who are watching out for them and caring for them. And that means putting into place systems and structures across the school that are caring structures for adults, like providing adults with access to mental health services and time to take off when they need it to access services that they need. It means providing time for adults to collaborate with each other and to have time with other adults in the building to talk about concern for students and to do the kind of teaming that LaShawn and Leslie were talking about. But it means structures that are in place for adults before we can think about what the teachers and adults can do to support students. So the question that Ashley asked was about tools and training and coaching for teachers. There are a number of different strategies and trainings that we know are really helpful for teachers to identify mental health concerns among their students and to know what trauma looks like and the different ways that trauma might present among their students and to know how to support their students. Programs like mental health first aid, programs like restorative justice, which some teachers have training in, different social emotional learning programs that schools are using are in place that provide teachers with tools to support their students and also give teachers the language that they can use to talk to students about mental health and about concerns that they have as well. Maybe I'll turn it over to LaShawn and Leslie also, if either of you wants to join in with this question too.
Yeah, I definitely want to emphasize ensuring that we're taking care of the caregivers first. And then just thinking through tools and resources that are already out there and available. I would be happy to share our Bridge to School plan, which was designed by New York City educators who, wanted to be really thoughtful about, one, how do we care for ourselves and each other? Two, how do we start working with families and understand, from them, let them tell their stories and understand what their needs are so that we can be responsive to their needs and design a plan to begin to meet the needs of the children in our school community, which may be different than the needs of children in another school community. So those kinds of curricular resources to think about the pre-work in advance of children coming into school, or to think about the pre-work as you're designing for your children who are now already in school. But then from there, how do you continue to do the work over time? So, we wanted to ensure that people didn't think that this would be work that we had to do in September when we welcome young people back, but this is work for the long haul. Is work for the long haul. If you were here in the beginning of this conversation, you heard about, what the Surgeon General is saying. You heard what CDC is saying right now. This is work for the long haul, and we have to think about meeting children where they are. They're in our schools, they're in our communities, they're in our places of worship, they're home with their families. So really thinking about those experiences that young people have, places that they go, and how do we meet them where they are. So in schools, we do this work through curricula and thinking through how do we ensure that we're focused on social emotional learning in every classroom every day, integrating this work with academics so that it's not something that's separate and apart from what teachers are doing in classrooms. And then thinking through additional experiences. So making sure there's alignment between what happens in your extended day program or your after school program. So there's been some effort in New York City and intentionality and partnering with one of our citywide agencies, Youth and Community Development, where they're in after school spaces. So as we think about consistency and returning to rituals and routines for young people, ensuring that what they receive during the school day in terms of support align with what they receive in the after school program, so that it's a seamless experience. We're focused on social emotional learning during the day, the same things happening in the after school program, the same things happening as part of the athletics program, whether you're participating in basketball or football, there's an emphasis on the work there too. So really working together with a degree of intentionality across, programs and youth services to ensure that we're being really strategic and thoughtful in providing tools and strategies and training and coaching and all of the spaces and places where our young people show up.
Thank you so much. Leslie, anything from you?
LaShawn said it all. I mean, one of the comments in the chat was integration. And I think that's something that we really have come to understand, is that there's, without question, there has to be an integrated response. And taking care of, as Jennifer said, taking care of teachers. One of the things that, highlight of success going back a decade or so was a consultation grant that was established by the Department of Early Education and Care in Massachusetts, which allowed partners like the Home Floor Wanderers to go in and do education with teachers and parents, coffees, informal, just psychoeducation, to say, okay, this is what trauma looks like. This is how you take care of yourself. This is how you create community in a classroom. And just attending to that in a supportive way allows for that kind of integration that impacted the number of young children who were being expelled from preschool. We saw the rates of kids being expelled from preschool decrease because of that focus. So this integrated response, you hear this over and over again from the three of us, is absolutely what's required as we think about the social emotional development of children.
So much. And I love this thinking, right? Like this is work for the long haul. And in many ways it's about, the opportunity here is for us to, what we talked about earlier, right? Address what we knew was happening and maybe didn't have our foot on the gas in the right way. And it's this opportunity to really reimagine what school can be, what it can do, and the connections outside of school that can take shape. And in that thinking, I have a question, this is for all of us. What staffing innovations are you thinking about right now? Like who is being overlooked in school communities that we need to sort of lift up?
I'm happy to start here. We have been really focused, like we've started some interesting work in New York City. I'm really excited about it. We're calling it the Family and Community Wellness Collective or Healing Collective. And, you know, we believe that a population that's being overlooked are parents being leaders in this space. So usually we look at the work, I'll speak for myself, we look at I look at the work from the lens of, you know, how do we support parents and families, but how do we activate families to be leaders in this space? So we worked with some philanthropic supporters to engage in some work in New York City where we did the same exact training for families, parent leaders, about 1,000 parent leaders here in New York City that we did for educators. We brought the experts in the same way we would bring them in for our teachers and principals. And we trained the parents through the support that we had. We were able to provide a stipend for each parent leader, about a $500 stipend. And the commitment was the training, but then also the parent leader would go back into their school community to deliver a presentation, to share resources with other parents. And that's the credible messenger that we need. That's how we really begin to address the stigma associated with mental health and wellness, because now you have parents talking to other parents from the same community. They're talking about other things anyway, you know, the teachers and what's happening in schools, what's happening in the community, their children, sometimes they have play dates and things of that nature. So now we have parents talking to each other. We have highly trained parents. They have the same training that we've invested in with our educators and our principals and other administrators, and they become our credible messengers, and they help to really, you know, address the stigma associated with mental health, because they're normalizing the conversation. They have a much deeper understanding, and they are often overlooked, our parent leaders.
LaShawn, that is fabulous. I want to connect with you after and hear more about that. That's something
Absolutely.
we should bring to Massachusetts.
Absolutely.
I'm naming it too, and similar to here in Boston, as in New York City, you know, it's a school system of families, majority of whom are folks of color. And so for so long, those families have been overlooked in our school systems. They have not been brought into the conversation and not been experienced as leaders in the same way that other families in different school systems have. And so what powerful work. And I think, Leslie, you in many ways were talking about this also earlier, really thinking about bringing in folks from the community to be liaisons and partners and create a connective tissue. So this is great. And thank you for all of you for leading that. There's a question from the audience, and I'm running out of time, and somehow I still have 20 more questions, and I'm incredibly thankful to Dr. Chard, who has been in our chat supporting our audience with some of the conversations that are happening sort of in a parallel process over there. But there's a question here that I think is really interesting for us to explore, and this is for everyone. And it's a question, and now I've lost it, but I'm gonna phrase it in the best way I can remember. And it's a question about apathy, right? Like, folks are tired, folks are exhausted, our kids are tired, our kids are exhausted, their parents are tired, the parents are exhausted, our teachers are exhausted, and we're experiencing staffing crisis, and they're covering classes that they're not used to covering. How should we be addressing apathy right now? How should we be thinking about that? And sort of where does your head go when you hear that?
I'm happy to take. I'm happy to. First of all, we have to start where people are and allow people to name that and talk about it, and to just to say, wow, I'm not feeling myself. I feel off. This is hard. This is yet again, at every level, and that it's okay. I think we often come from this place of, well, this is hard for me, but I know somebody else has it harder. But that, your life is your experience, So starting where people are. But I'll also add that I think it's important that we try to, as best we can, re-innovate those normal routines for kids and for ourselves, to pay attention to the things that you need to do for yourself and that children need, that are a part of just, normal kinds of activities. And we've been talking a lot about that inside my organization, how to help families, how to help kids kind of, go back to, not go back, but to be rooted in the things that stability that gives comfort. So if that is, getting back into an after school activity, that is connecting with friends as best you can, even if it's, as safely as possible, but getting back into some of those routines, that this idea that somehow we are going to, Ms. Vetter said, get through something and we're going to come out the other side and it's going to be the way that it used to be. We're now in the third school year, as we talked about. That is probably naive at this point, that we so I think that the piece around just, oh my gosh, it just seems to never end. Naming that, starting where people are, but also creating those rituals and routines that ground us.
Anything for you as you're thinking about apathy and the audience member who had asked this, even named, like, it seems so widespread, it almost is contagious, is the language that was used.
Yeah, I'll just echo what Leslie said, and some of the names for what you're describing, Leslie, are pleasant event scheduling. So making sure to schedule things that we know bring us some joy, even if we don't feel like it necessarily, and behavioral activation, the idea that we might need to start doing some things again, even if we don't feel like it yet, and that by re-engaging and doing those things, and I think Leslie, you said kind of re-entering routine is the way you talked about it. We can start to move back into being more active again, even when we don't necessarily feel like we want to do those things at first. That if we continue to not do them because we don't feel like it doesn't tend to lead us to want to do them more. What tends to lead to us wanting to do them more is by going and engaging in those activities.
That's very well said, Jennifer. One of the things I talk about with my staff is, I end meetings and I say, go drink water, go take a walk outside, like do those things to take, remember to eat good food, and just do those things to take care of yourself. Those normal kinds of that create the routine that we need, that provides us stability.
Sean, I'm going to give you the final word on this one. What are you thinking, and how should we be thinking about it?
I'm thinking that there's safety in groups, and there's healing in groups. And there's something powerful when you bring people together just to name their own experience and then to learn and grow together. So anytime I hear a theme, so if I'm identifying a theme as the participant did on apathy, I always think, how do you bring people together to acknowledge and let them tell their own story, and then the group will take care of itself. So how do we create those structures or create space for these kinds of conversations to happen and healing to happen through the comfort of a group?
On that note, I want to thank all of you for our togetherness tonight. And I feel really lucky to have been with each of you, to learn with each of you, to think with each of you. I have also been equally inspired by the questions and the conversations in the chat. And if you are like me and you can't read them and watch them at the same and watch us at the same time, take a minute and go back, because this is the work and we are all doing it in different ways, in different pockets of the space that we work in. But this conversation in the chat and this conversation here over Zoom tonight has given me incredible hope, because we have stayed in a space of possibility and opportunity while recognizing that there are real problems that we need to address. And I want to thank our panelists for the incredible work you do every single day to cultivate healing, to create equity, to accelerate opportunity for kids. And of course, thank you to BU, Wheelock, and to Dr. David Chard for hosting us tonight. And thank you to everyone who joined us this evening. It really means a lot to have you. And I look forward to our next conversation with you. Good night.
Thank you.
Thank you.
Thank you.